sorry to drop over. This lecture may run a little bit long, and I don't want to keep you guys late. And I don't want to do that for work, so I have to work here too. Just so you guys know, my name is Mark Silver. I'm the Associate Program Director here. I've been here for a long time. And since I just went on vacation and went diving, I figured I'd give you guys my diving lecture. So we're going to talk about all the dangerous things that are under the water that can envenomate you. So this is where I work. This is where I train. You guys may not know it, but it's the Sea Building. It's old school, nasty, brutal place, but I get the best training in the world. This is what it looks like now. This is where you guys are training. It's much prettier, much nicer, much more relaxing looking. So today we talk about the venomous sea life that's underwater, and we're going to talk about things that either impale you or sting you. That's how we're going to break it down. All right? There are two very, very different symptoms and two very different causes. All right? We're going to talk about treatments, and then a little bit about gases that can poison you as well. So just so you guys know, I will do anything for a good picture, and I will do anything to support my program. So this is me in Hawaii last year, very rough time, very difficult. I lead a very difficult life. This is what I usually look like on vacation. When we go diving, I'm usually away from the group, as I have a camera, I don't want to be with the group. I don't want them to kick up all the silt on the bottom, and plus, I've done a lot of training. I don't worry about having a partner underwater. A lot of people think when you first dive, you learn you should be partnered. But once you do technical diving, where you're diving very deep in wrecks and caves, you learn to be self-reliant. So I've done quite a bit of training, so I don't recommend you guys do this on your own. This is probably the most dangerous thing underwater. This is Dr. Doty. For those of you guys who don't know, Dr. Doty was the program director here for a little while. He's now the director in Kentucky. And he's been my dive partner for many, many years. And we play jokes on each other underwater all the time, like shutting each other's air off, putting things on his head. It happens. But very, very dangerous underwater. So just a quick thing about terminology, right? You guys know the difference between poisons, toxins, and venoms. What's the difference? So what's poison?
You eat it, there's some poison and venom. If you eat it and it hurts you, then it's poisonous. If it bites you and you're hurt, then it's venomous, right?
Kind of close. A poison is any substance that causes disturbance to the organism. It's usually on a chemical or molecular level. It's anything out there, any substance that can injure you or hurt you. Right? Everything is actually a poison. It just depends on dose. Right? If you get too much water, you get hyponatremia. It's a poison. If you get too much oxygen, you get oxygen toxicity. It can be a poison. So anything can be a poison. It just depends on dose. So what's a toxin? A toxin is a poison that's made by a living organism. There are a lot of poisons out there that are not made by organisms, and there are some that are. Right? It's usually a small molecule, either a peptide or a protein. Something like botulism is a toxin. Botulism toxin is a toxin. All right, kind of makes sense. It's made by the botulinum microbe. So what's a venom? You sort of got into it. A venom is a toxin caused by injected or put across your skin by venomous animals. But it's got to do something to get across your skin. You can't ingest it. It's got to be put across your skin, right? So it can be injected, like a bite from a rattlesnake. It can be through a stinger, like from a bee, from a yellow jacket, from a wasp. Scorpions have things called, centipedes have things called forciples, which I thought was kind of interesting. And then something like caterpillars have urticating hairs. So they can also pierce your skin and cause envenomation. So we'll talk about underwater envenomation. There's a lot of things down there that can hurt you. You have to know to stay away from them. We're going to break it up into food categories, right? Because I think that ER doctors all pay attention to food. It's one of the most important things in our lives. When I go to a conference, I actually don't look what the conference is. I look at where the good food around the hotel is. So if you can remember two facts, you'll know all about envenomation. If it stings you, marinate it in vinegar. If it stabs you, cook it up in the hottest water possible. If you can remember those two simple facts, you'll know everything about envenomations. So you look at me like this, is it really that simple? This gray angelfish would not leave me alone, kept bumping into my camera, wouldn't go away. So sea urchin in this form, very tasty, very not dangerous. Actually good. Sea urchin in this form can be very painful. Right? I've gotten many, many, many sea urchin spines in my fingertips. I've had one that I stepped on, went through my boot. They can be very, very painful. The bad thing about them is when they do stick you, the spines break off and you get a little piece of spine stuck in you. That's organic matter, and it's going to lead to an abscess. It's going to lead to more problems. Right? They can get infected. If you leave a foreign body inside your body, it has a high chance of getting infected. And some people say you can get tattooing from it. I've never really seen that, but people say you can. I have some pictures of it, but basically what happens is the sea urchin spine has a black color to it, and as it stays under your skin, it leaches out its color, and it turns your skin black, and you may never get rid of it. These spines are not just simple sharp objects. They're actually covered with an integument, which is like a skin, and underneath that skin is where the venom sits. So if you just got stabbed by a simple spine, it wouldn't be nearly as bad as being envenomated. So they have the venom sitting inside their spines. The other thing about the spines is they don't show up on x-rays. You can't film the person to see if it's in there like you can for a tooth. It doesn't help. So a little bit hard to do. You have to have a high index of suspicion. But sea urchins are slow moving. Don't sit on them. Don't play with them. So this is Dominique Fontenette. Dominique's a grad of our program. This is her first dive trip. And we took a bunch of sea urchins and stuck them on her. Sea urchins have these little tiny feet that when they get the stuff, they stick to it really, really well. They actually really, really stick to it. So we put them all on her hands and all on her chest, and she had trouble getting them off. All right, this is in Hawaii. That's that fish from Finding Nemo. It's called. You guys don't recognize it. More sea urchins. Pencil sea urchin. Not all the sea urchins have big, sharp spines. Some of them are dull. This is a pencil sea urchin. And more pencils. Kind of looks like a pencil. So again, these guys stab you. Right? They have those big, long, sharp things that stab you. So put them in the hottest water possible. Right? Their proteins and their venom are heat labile. So if you put them in hot water, it should break down the protein. It should make the envenomation less serious. Remember that some of these venoms may cause you to be insensate. You may not feel anything. So you want to check the water temperature first and make sure it's tolerable. Always put your hand in the water before you put theirs in. All right? You want to make sure you don't burn them and give them a second injury on top of their envenomation. Use tweezers to pull them out. Be very, very, very careful because they do break off. Easy to crush them. And they have barbs, so as you're pulling them out, you'll feel there's resistance. It's hard to get them out. Luckily, this is not my hand, but I have definitely been stuck by sea urchins before. Actually, on this last trip over. It's pretty painful. It's like getting stabbed with anything else. You want analgesics. And then you got stabbed underwater. There's a lot of stuff in the water like Vibrio, fish urine, fish feces. So you want to make sure that you give them antibiotic coverage. There's never been any study that shows it's helpful, but we all do it. It makes sense. All right, let's move on to the crown-of-thorns starfish. This is the only venomous starfish out there. And these guys can be very, very, very large. They can get up to about 1.5 feet, 2 feet sometimes. All right, they're Acanthus plantae. And they're mostly found in the East African coast, Indo-Pacific, Red Sea. This picture is mine from Hawaii last year. I will tell you guys that all the pictures in the lecture are my diving pictures, except for like 1 or 2, and I'll tell you what those are, but they're all my pictures from underwater. Right? They have a very large stomach. And what they do is they'll take their stomach and involute it, and they'll just dump digestive juices all over the reef under them. And then once the coral is digested, then they suck out all the food part of the coral, put their stomach back in, and move on to the next coral head. And they're really, really, really efficient at this, and they can destroy a reef very, very quickly. So they're a big problem to reefs. They're the only starfish with human toxicity, but again, they're slow moving. Don't sit on them. Don't put your hand down on them. They're not different. They're big, huge starfish. They're not hard to miss. So if you do get envenomated by one of these guys, again, they have the spines with the venom under the integument. It may cause nausea, vomiting, definitely hours of pain. Some people can get anticoagulated from them, so you can get prolonged bleeding, especially if you have a big hole in your hand, a hole in your arm, where you hit them, and now you're bleeding out of that spot. A fair amount of swelling. And these starfish secrete something called a saponin, which not anything else really has. All right? And every age does it, even from when they're little tiny baby starfish all the way until the end. And the interesting is this saponin that they secrete, that's their poison, it actually turns water like foam. That's how it got its name, actually. And then again, they're underwater so you can get infected. If you were to throw one in a bucket of water, this is what it would turn into. All right? It looks like you have soap in the water. That's why it's called saponin toxin. So again, you want to pull out all those things that are inside you. You don't want any spines left inside. You don't want them to cause foreign body reactions and cause abscesses get infected. And then it may still be envenomating you. If there's a lot of venom around in that sheath, it doesn't get absorbed all right away. The faster you can get the spine out, the less venom that you get, the less of a hit you take. So again, heated water, they stab you, so the hottest water possible. Analgesics is probably helpful. You may want to use like a scrub brush. One of the things we do when we go on vacation is we steal the brushes from the operating room. Those things are great for fixing injuries. Right? It scrubs out all the crap that's in there, has a nice chemical in there that destroys all the living organisms in there. That's what it's supposed to do. And then these guys may itch a little bit afterwards, so maybe some hydrocortisone or some topical antibiotics may be helpful.
Brushes that like to make.
The fingernail brushes from the operating room.
I thought like before they prep.
No. It's actually a plastic brush that has little bristles on it. And you're supposed to use it for your fingernails before you scrub the operating room cases.
Those.
Outside the operating room, in the sinks.
I got you.
This is another kind of starfish, one of the more pretty ones. Right, this one's purple and red, very, very beautiful, but very dangerous and very venomous. Jellyfish are kind of cool. We like to play with them underwater. Bet you guys didn't know if you poke a jellyfish right in the middle, you can turn them inside out. What you also didn't know about jellyfish, this one has very short tentacles, but jellyfish like to hunt in pairs. So Dr. Doty here is poking that one and turning them inside out, but this one's coming again. Right, they don't really have brains, they don't really hunt, they just kind of cruise around. But definitely watch out for a second. So jellyfish are cnidarians, and there are over 9,000 species of jellyfish, but only 100 are toxic to humans. And their toxicity depends on a few things we'll talk about in a second. All jellyfish are circular, or all real jellyfish are circular. And this is important to remember when we talk about the Portuguese man of war. All right, the Portuguese man of war is not circular, we'll talk about that in a little bit. Jellyfish are made over 90% of them of water, which you kind of figured. They're very clear, they're very mushy, they're squishy. And they kind of pulsate to move them, so you've seen it, they kind of go in and out. Inside their bell, inside their dome, is their stomach. And you may actually find fish or other stuff in there when you see them, and they're in the process of digesting that stuff. They have these tentacles that hang down, and that's the business end of the jellyfish. That's the part that has the stinging cells that can injure you. I did find interesting that jellyfish are the favorite food of sea turtles. And this is really important to know because if you go out on a boat and drop a plastic bag under the water, by accident, your sandwich bag, it looks like a jellyfish in the water. And turtles don't eat them. But then they get small bowel obstructions and they die. So I love turtles, they're beautiful. They're my favorite animal in the water. Please don't make sure you drop nothing plastic in the water when you're by the water's edge. So again, there are a lot of jellyfish species out there, and whether they can hurt you or not will depend on two things. It'll depend on the venom that they have and the size of the stinging cells, the nematocysts that they have. A lot of jellyfish have very small cells, and they can't cross your skin. If they can't cross your skin, they can't envenomate you. Remember, to be envenomated, something has to deliver the toxin across your integument. So if they can't cross your skin, if it's not strong enough or not long enough, they can't envenomate you. It also depends on your weight. If you're a little child, a 3-year-old or a 2-year-old that mom's walking through the wading pools at the beach and you get envenomated, it's much, much worse than if you're a big fat guy like me getting stung once or twice in the water. All right? So it depends on your weight. Again, the nematocysts are the stinging cells, and for the most part, they can't really cross your skin except for a couple species, and a couple of them are really, really bad. Once you do get envenomated, there are 3 different syndromes that you can get. You can get immediate toxicity of the venom. You can get an immediate allergic reaction if you're allergic to the venom. You know, we have a lot of allergic reactions here on land, and you have troubles breathing, you have difficulty. Imagine what happens if you're underwater and that happens. Pretty bad. Then you can also get delayed allergic reactions, which is like itching and stuff like that, which happens down the line, which I've seen quite a few cases of. Here's a little about nematocysts. All right? Nematocysts are cells that have this apparatus inside them. And they have a lid on that little package and a trigger. When you hit the trigger, it opens the lid and that barb comes shooting out. That barb has been sitting in venom this whole entire life and it's covered in it. As it comes shooting out, it crosses your skin and it delivers that venom to you. Actually, people have looked at this on fast motion cameras, and this is one of the fastest things in nature. Right? It takes only hundreds or thousands of a second for this to occur. It's very, very quick. All right? It's very, very fast. You have to hit the trigger to happen. There are multiple toxins in the venom, different proteins, different other stuff we'll talk about, but there's a lot of stuff in there. And then they have barbs, so they stick in you, which you kind of don't want. You want to get them out. And we'll talk about how to get them out and how to get rid of them in a little bit. And again, you can be allergic to it. It's not just the toxin. You also can be allergic to it, so that can cause a second problem. So I put this up there so you can see all the different things that jellyfish make and poison you with. Right? Once they get their venom across your skin, once they envenomate you, all these different things, histamine, hyaluronidase, kinins, phospholipase, they can all injure you. This picture I put up to is really, really important to me. This is a box jellyfish. From you guys remember, there are only a few bad jellyfish. The box jellyfish group are the usual bad ones. But they're only supposed to be in like Australia, the Indo-Pacific, like they're not supposed to be anyplace else. So I took this picture actually in Bonaire a couple of years ago, where I was last week. This is from Bonaire. And to have a box jellyfish in the Caribbean is very, very, very rare. And actually nobody knew about the species up until a couple of years ago. What's really funny is I took this picture, and about 6 months later, this jellyfish got its name as the Bonaire box jellyfish. So I had a picture of it before anybody knew what it was, before anybody named it. I looked in books, I couldn't find it, and I was like, I just didn't find it. And I didn't think there would be a new species. But I could have got a name after me if I could. So these are the box jellyfish that you really need to look out for. These are the Chironex fleckeri. These are the really big, excuse my language, badasses of jellyfish. Right? These are the guys that you don't want to get stung by. These are the ones that live in Thailand and Australia. These are the ones that will kill you. Almost all jellyfish deaths are due to Chironex fleckeri. Almost all. Right? But again, they're in Australia. They're the most dangerous jellyfish. They have multiple toxins in their venom. And almost all the deaths associated with jellyfish are due to Chironex fleckeri. They get very, very deep penetration of their nematocysts, which is why they're so bad. And some people even say they can get through medical gloves. The skinny little surgical gloves, they can get through them. So you should use like dishwashing gloves or big leather gloves, or even pickups or something else when you're pulling the tentacles off somebody if you do happen to come across an envenomation. But some people say it can go all the way through surgical gloves. It's kind of scary. A jellyfish can get through that. It's really a big deal. A lot of local pain, but also a lot of systemic stuff. Right? Nausea, vomiting, fast heart rate, slow heart rate, a lot of other problems. These guys do have 24 light-sensing eyes, which I don't believe they really have a brain that's big enough to figure out how to chase things, but people swear that underwater these jellyfish have changed direction and come after them. They swear by it. But I don't think they're smart enough to really do it, but some people say they do. Again, the envenomations, very, very bad. Cause a lot of scarring, very deep, very, very bad envenomations from Chironex. The Portuguese minnow I want to talk about is not a real jellyfish. It's actually a hydrozoa, but it looks like a jellyfish, it stings like a jellyfish, so we group them together. But it's actually a colony of hydras. Right? If you've seen these guys, they have a big purple float that floats on the water, and they have up to 30 feet of tentacles, or up to 100 feet of tentacles, hanging down below them. So you'll often see, even here in the Northeast, I've seen on many, many beaches, you'll see these guys floats, the purple floats, on the shore after a storm. Because the storm gets big waves, and the wind blows them up onto the beach. But they have no tentacles at that point. You just did a nice purple float. But you got to realize that they had tentacles at one point. Just that they were beat up so bad in the surf that all the tentacles got ripped off. So if the floats are up on the beach, the tentacles are probably there too. And the tentacles remain active for a little while after they rip off the jellyfish. So you want to make sure you don't lay in the wet sand after a storm, because you definitely can get envenomated. You want to be careful about it. And again, they had that big purple float. It's real easy to see them coming. They float on top, and it's a very, very ominous sign to see them coming towards you. This is a picture we took down in Florida, although I definitely have seen them in Long Island. But this one's from Florida. This one was from one of the Caribbean islands. I forget which island I was on. And there's another one from a different island. So I've seen them many, many, many places. You just really need to avoid them and don't go near them when you're in the water. Because their tentacles can be very, very long and stretch for a long, long distance that you just don't see. So these guys sting you. They don't stab you, they sting you. So the way to treat them is marinate them in vinegar. All right? If you go to Australia during jellyfish season, they have 55-gallon drums of vinegar on the beach, just in case people get envenomated by Chironex fleckeri. All right? You have to dump their whole limb. What you can do is you can dump a towel in the vinegar and wrap the towel around your arm. But you want to get vinegar on these stings as soon as possible. Because when you get stung, the tentacles can stick to you because you pull away, you rip them off, and then they sit there. And they will keep envenomating you. More cells will release more cells and more cells, and you just keep getting envenomated worse and worse and worse. So you want to make sure you deactivate all the cells. You also want to get all the tentacles off of you. And there's a couple different ways people recommend doing that. You can use a credit card and scrape them off. If you have shaving cream with you at the beach, because we all carry that, you can put shaving cream on your skin and then use a credit card. I don't even carry shaving cream at the beach. You can just use sand though. Just take sand and put it on your arm, wherever this thing is, and use a credit card to scrape the stuff off. But these are all things that people say they do. There are a lot of myths out there as to what you can do for jellyfish stings, right? Fresh water is probably the worst thing you can do. Remember, those cells are packed under pressure. They're ready to burst open. They have a little lid on them holding them in. If you add fresh water there, that fresh water jumps inside the cell by an osmotic movement, and then it bursts the cell. Remember, it doesn't matter what bursts the cell, but if the cell bursts, that venom is coming out as you. So if you put a big thing of cold, fresh water on your arm, every cell that's there is going to open up. It's all going to burst, and you're going to get envenomated worse. So use seawater. Try not to use seawater that has more jellyfish in it. Right? If there's one jellyfish there, there's more. So be careful what you pick up. But fresh water will definitely make it worse. Similar for alcohol, lemon juice. People say you can pee on your friends and make it better. If you want to pee on your friends, that's up to you. But it's not going to help the jellyfish envenomation. But whatever you're into, hey, that's you. Chironex fleckeri does have a specific antivenom to it. Right? Because that one is such a bad envenomation, people have developed an antibody to it, an antivenom. So that one single envenomation does have it. And you get stung in Australia, they will take you to the hospital and they will give you the antivenom. But that's the only one that has an antivenom. Everything else is symptomatic treatment. Fire coral is another stinging object that's underwater, which is all over the Caribbean. I think if I do 3-4 dives a day, I probably get envenomated by fire coral 2 to 4 times a day. Just because I'm taking pictures and I'm trying to put my hands around stuff, I'm not looking where I'm going, so I'm taking pictures. It is every place, and it has all sorts of shapes. It doesn't only look like one thing. What you look for is this light brown color with these little hairs sticking off from it. You guys can see that? I have other pictures of it too. But they have these little hairs. But they can be in any form and any shape of the coral. These guys are also hydrozoas and millipora. They're every place. They're more of an annoyance than anything else. When they sting you, it's annoying, it hurts, it burns for about 15 minutes and then goes away. I got a bad envenomation last week right here, which you can see there's a little bit of a scar left still. But I was taking a picture and I put my hand up against an elkhorn coral and got the whole entire arm envenomated. That was a bad one. Usually you just brush against it and it's only small. That one was kind of bad. But remember, these guys sting you, so marinate it in vinegar. All right? They have those white stinging hairs. Every hair has a million little nematocysts on it. They sting you. Use vinegar to deactivate it. Here's another picture of one in a different branching shape. You can definitely see the hairs more obvious. Here's a more thicker version, but all these sections all covered in stinging cells. So this big flat surface here, you can see if you put your arm against that, you get a very large envenomation. It's not just a little skinny whip. Here's some more skinny ones. This is actually the one that I got stung by. At one point, not my arm, but this is a different one on my shoulder. It doesn't move very fast. It's coral, so try and avoid it. But if you're underwater taking pictures and not paying attention, you pay the price. So this is one of the kids on my trip last week, and he was playing down by the shore, and one of the waves pushed him into the pier stanchion, and it was covered in fire coral. And you can see he's got this big envenomation that's all swollen, all red, across his belly. He was very unhappy. It was very painful. We doused him in vinegar. He was very unhappy about that, because now he smelled like vinegar and he was crying. But it's the cure for it. It makes it feel better. Fireworms, these are polychaeta. These guys are really cool underwater. There's these little tiny worms that are red and white and fluffy looking. They're very, very cute. A lot of people buy them for their aquariums, saltwater aquariums at home. The problem is that these cute little worms like to eat stuff, and they like to grow. And some of them can grow to be 2 feet long. So picture a 2-foot-long stinging worm. I actually saw one on this trip, which I don't have the picture for you to put in, but it was almost 1 foot long. It was probably about like that. It was tremendous. So these guys have these stinging hairs that stick off of them. They impale you, they hook into you, and it's very, very annoying. They're made out of chitin. They're really, really annoying. Right? It's very painful. You want to get those spines out of you, because they stick in there and they have little barbs. So take a piece of tape, put it on your skin after you're dried off, and it should pull the hairs out. The fireworms are the one exception to the rule that I need you to memorize. These guys stab you, but they still respond to vinegar. All right, so they're the one exception to the rule. Every rule has its exceptions. Here's a firework envenomation from a few years ago, one of the ladies in my dive booth. It's really irritating, somewhat painful, and definitely very, very annoying. Here's a big one that I saw, I guess 2 years ago now. This one's probably a good like 6 or 7 inches long. Pretty nasty. So I do want to say something quick about fish injuries underwater. There's a lot of fish down there that will torture you and will come after you and bump into you. Not because they want to, or some of them because they want to. Right? These little tiny damselfish are about this big, and they're very territorial. If you put your hand in their house, they will come out and attack you. It's kind of funny, it's a little tiny black fish that keeps running into you, poking you in the mask. They don't hurt, but it's just an annoyance. Scare the crap out of you when you're taking pictures and you're not ready for it. Stuff like the piranhas down in South America, they will definitely do much more damage to you. This piranha needs a dentist. You see all his teeth are missing. He's kind of an older piranha, needs dentures. Triggerfish are actually really angry fish that if they're in mating season or they're being defensive, they will come after you. And they have really sharp teeth. I've actually seen triggerfish like bite divers' fins and chew through their fins. If you guys have been diving, fins are like the most indestructible piece of material out there. It's unbelievable how tough they are. I've had fins for over 20 years and not got new ones yet because they're not breakable. These things will actually bite through your fins. So definitely don't mess with triggerfish. They're very pretty, they're very nice, but don't mess with them. If you see them, just back away from them. And then don't do things that'll put you in a position to get bit. This is my ex-wife, who we were diving in the Caribbean, and we were feeding them hard-boiled eggs. I don't know why fish like hard-boiled eggs, but they do. Don't ask why, but it's not a natural food, but they eat them. But you can break it off and give them little pieces. And it's fun for the pretty, French angelfish. But these guys, yellow snappers, are like the piranhas of the sea. They will eat anything, and they have no fear. They will actually swim into your BC pockets to pull out food. They have no fear of you. They have razor-sharp teeth, and they will definitely take off a fingertip. So be super careful. The moral story is don't do anything stupid. If you don't want to get bitten, don't do anything that's going to get you bit. For all trauma injuries, you do your basics, you do your ABCs. That's what we teach you. Anytime any ER doctor asks you what's the first thing you do for a patient, just automatically say ABC. It doesn't matter what they have. It's always ABC. Right? You want to film them. Fish don't have dentists, although they do go to cleaning stations. This group was at a cleaning station having those parasites taken off by these little fish who were swimming in and out of his mouth, through his gills. That's how they say parasite-free. But they don't have dentists, so their teeth fall out when they bite you. You got to get films to make sure there's no teeth left inside. And then again, if fish saliva is on there, you're in seawater, so they should probably get antibiotics. Nobody knows the truth, but we probably give it. Some of the bigger stuff down there, green morays, we call them green meanies. They're probably any place between 5 and 10 or 12 feet long. They're probably as thick around as my waist, and they have 2 sets of teeth, one running around the outside of the mouth and one running over the hard palate. They have incredibly bad eyesight, so they can't tell the difference between a little fish and your thumb. So if you put your hand near them, they may come out and take your thumb off. I've seen videos online where that's happened. They are super, super, super aggressive if you mess with them. So take pictures, don't go near them, just stay away from them. On this trip, I had a really big one that I was using my GoPro and filming, and I put my hand right in front of his face because the GoPro needs to be close, and he started coming out at me. Only the dive was like, and I started pulling my hand back slowly, and he started coming out of his hole at me, and I was like, okay, that's enough. Dolphins, really, really adorable animals, very, very intelligent, and usually very playful, very happy to swim with divers. They'll play with you and swim around you and jump over you. But if you piss a dolphin off, a fish that can swim 60 miles an hour and weighs 200 pounds is like getting hit by a car. Right? If these guys bang into you on purpose, you will definitely know about it. Right? They can do a lot of damage. And there's a lot of reports of dolphin injuries. Because they're so nice and playful, people don't worry about them, but they can definitely do a lot of damage to you. Straddle injuries, very dangerous underwater. This is a picture of me down at 100 feet on a wreck called the Homo Hooker. We do this for a dive every single year. And bushwhackers will definitely hurt you. Right? Bushwhackers are 7 shots of the dark liquors mixed in with some milk. It tastes like a pina colada. They only limit you to 2 at the bar. For good reason. I've tried to walk home many times after 2 bushwhackers. Definitely injured from. So let's move on to scorpionfish. Scorpionfish are very difficult to see underwater. They have great camouflage, you can see from this one here. Right? It's really easy to put your hand down on a scorpion fish, especially when you're taking pictures, not paying attention. All these spines across the top are super venomous and super sharp. And then there's some on the pectoral fins as well. But these spines are all super venomous, and it's really, really a painful envenomation. Alright? So in this category, there are scorpionfish, stonefish, and lionfish. Some people consider frogfish too, although I'm not sure they're that venomous. But stonefish are only found in Indo-Pacific and Australia. Have you guys noticed a trend? If we have something here that injures you, if they have it in Australia, it's way, way 10 times worse. All right? We have the black widow. They have the red fiddleback. The red fiddleback is like 1,000,000 times worse than a black widow. All right? We have scorpionfish. They have stonefish. It's way, 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 way worse. All right? And then lionfish. Lionfish are really a Pacific fish, but somehow somebody introduced them to the Caribbean, and they have no predators in the Caribbean. So they're tremendous predators themselves, and they destroy the reef. They eat anything they can find. They're super aggressive, and they're crazy thievers. So they destroy the reef. So us divers, our reefs are getting lost. We're losing all our fish. So all of us try and hunt scorpionfish, and lionfish, and try and get rid of them. And I'll show you some of that in a little bit. But they're really, really amazing predators. But they're definitely venomous, and you definitely don't want to mess with them. If you get struck by these guys, the whole group will cause intense, intense pain. Really, really, really bad pain. The stonefish is definitely, by the way, the worst out of them. If you get hit by a stonefish, you want to go directly to a hospital, because you are definitely going to need narcotics. You can get some systemic stuff, hypotension, hypertension, tachycardia, delirium, diarrhea. You can never find a toilet underwater when you need one. They can cause really, really nasty envenomations. Here's another scorpionfish, different color, but you can see they blend in with their environment. It's really easy to put your hand down one, or to kneel on one, or to sit on one when you're doing drills. It's really easy to get envenomated by these guys. And all their spines across the top, this is the business end of the scorpionfish. I don't worry about their mouth, I worry about the spines. These are lionfish. They're really, really beautiful. People have them in their fish tanks at home. Also, again, these spines, super, super, super venomous. Right? On this trip, I get envenomated by a lionfish. This is my first time being hit by one. We took a spear gun down, we were spearing them, and then we put them in a bag or a box afterwards, and to get them in there, sometimes it's difficult. So what a lot of us will do is, you'll take scissors and cut their spines off. But while I was cutting their spines off with a scissor, I wasn't paying attention, and I got stabbed in the finger. And I was like, oh wow, I think that's probably going to hurt, but we'll have to see what happens. Within about 10 minutes, it was intensely painful. It lasted for 12 hours. I was in intense pain, and it blew up. I'll show you some pictures of it. But my hand, my one finger was like 3 times the size of all my other fingers. It was terrible. Super, super, super venomous. Don't touch them. They're pretty. Don't touch them. Actually, the other guy on the trip with me has a saltwater fish tank at home. And his lionfish at home is only about 4 inches long. While he was cleaning the glass of his tank, his lionfish swam into his arm. And he also got envenomated. So even the little ones, they have the same poison as the big ones. So they can do a pretty nasty job. Frogfish I thought are kind of cool. They're really not as venomous as the other 3, but they're really hard to see. I mean, if this one didn't have its mouth open and you were looking at him, you wouldn't even know it was there. They're really cool looking fish. Here's my hand afterwards. This is what it was a day later. It was starting to come down. But it's definitely way more swollen than the other finger. And it was really intensely painful. As soon as I got back from the dive, as soon as I got on shore, the first thing I did was take 2 Percocet. It was really, really, really painful. Hope this video works. I have to do this from the computer. The answer is no.
Right, did you right click on it?
Try exiting out, like pressing escape. And I don't think it's
It shows
there. But go up on top on playback. You see where it says video tools?
Preview?
Yeah, on the preview.
Yes.
Yeah, it's not there. It's on my home computer, but it's not there. All right, no big deal. It was a cool video of me spearing a lionfish. Sorry, guys. So it was a lot of fun, because what happened is on this dive, or on this trip, my camera flash died on the second day. So it's one of the possibilities of diving. Things get salt water in them and they die. So my camera flash died. So I had nothing to do. I had no camera to use. So I asked the dive guy if I could take down the spear. He was like, yeah, sure. Most people won't let you do it, but we've been to Bon Air probably, I don't know, my dive guy's been there 30 years in a row. So he said, yeah, sure, take the spear. So we took the spear down and started shooting them. And on the first day we were doing it just for fun. Then we realized that lionfish are good to eat. So we took down the keeper and we started collecting them. And by the end of the week we had more than 30 lionfish that we'd shot. And then we took and made ceviche out of them, made little fingers out of them. They were really, really good. If you guys ever go on vacation, I encourage you to eat lionfish. It's good for the breed. So again, scorpion fish, they stab you. Those big, nasty spines. So the treatment is, cook them up in hot water. Alright? Hottest water you can take. The stonefish is, because it's so bad, has its own antivenom. Right? But that's the only one, none of the others do. If you get hit by a stonefish, or even any of these really, I would urge you, or I would encourage you to seek medical attention. If you don't carry narcotics on board with you like I do, you should definitely seek medical attention. It is really, really, really painful. Take my word for it, don't get infected. Stingrays are kind of cool. They call them sea devils, the pussycats of the sea. Ray sharks and skates are one group of fish that have no bones in their body. They're all cartilage. Right? Kind of cool. They have no teeth. They have grinding plates. Right? I've definitely got my finger in a ray's mouth before. Don't ask how, but I have. Doesn't hurt that much, just kind of feels like squishing. But their business end is their tail. All right? They have this big dentin spine on their tail that's serrated, very sharp. And again, it's covered with an integument. It's covered with venom. So when these guys envenomate you, you will know about it. The good thing is that rays are not mean animals. They only stab you in defense. Most of the time, it's because you step on it while you're walking through shallow water. If you come across a ray and come next to it, it'll be scared of you and it'll take off. It'll go away. But if you step on him and pin him to the ground, he can't get away. Now he's freaking out and he needs to use his defensive mechanisms. And that's when they get stabbed. So most ray injuries are from the waist down, because you step on them and their tail comes up and stabs you in the lower limbs. I do think it's cool that a group of rays is called a fever of rays. You tribute people out there. Manta rays are awesome. Manta rays have no barber in their tail. This is me diving in Hawaii with the manta rays. If you guys ever go to Hawaii, I highly recommend you do this. What they do is they put 30 people on the bottom together, everybody with flashlights, and in the middle of the night, and all your flashlights have beams of light going up. And all the plankton like light, so they swim into the beams of light. All the rays like plankton, so they swim through your beams of light. And if you're really lucky, you can get a ray that likes your beam of light and goes over you, flips around, and comes back at you, and keeps going around over you. To have a 7, 8, 9, 10, 12-foot ray swimming right at you is just a cool thing. These guys have no teeth, they can't hurt you. All they have is an open mouth that goes down into an esophagus. You can look all the way down inside them. They can't possibly hurt you. It's amazing how agile they are. They can stop, turn on a dime. They'll come right at you and then go over your mask. It's really, really an amazing thing to swim with. If you go to Hawaii, go to Yap where they have it, you should definitely do this dive. It's amazing. You can actually do it from snorkeling too. What they do is they put a surfboard in the water that has 6 holes cut in it, and they put lights in each hole, and then you hang onto the surfboard. And the rays, when they swoop across the divers, will then come up and swoop across the board. And then divers and board, and they go around in a circle, around and around and around. It's very, very cool. Stingrays cause local trauma, usually it's to the legs, like I said. It causes a lot of swelling. If the spine breaks off, it gets retained in you. You should never pull it out. You should know this about all trauma. Never pull anything out unless you're sure it's not in a vascular structure. Right? If you get stabbed in the lateral thigh, there's nothing vascular out there. If you get stabbed in the butt, there's nothing vascular out there. But if you get stabbed in the popliteal fossa, there's stuff in there that you probably don't want to untamponade if the spine is sticking into a vessel. So these guys should all go to the operating room to have it taken out if it breaks off. The other thing too is it's serrated, and it's pretty hard to get out. All right, I've taken serrated knives out of people before, and you need to really grab them and like work them to get them out. Envenomations occur too, besides just being stabbed, don't forget. And if you're going to die from a stingray injury, usually it's due to hemorrhage. Usually they'll nail a big artery or your heart, like Steve Irwin. Right? Steve Irwin was trying to ride a ray. How dumb is that? Sticking on the top of them where the barb is. You're not supposed to mess with them. You're not supposed to jump on them. He got stabbed in the chest, and then they pulled it out. And what did that? People get pneumos, and they get heart trauma. Those are the acute deaths, and then later on you can get sepsis from the wound. Those are the later deaths. But it's rare that a ray is going to kill you. Here's Dominic again at Stingray City, where you can actually feed the rays. What they do is they bring down a little tube that has squid in it. And then each person gets one piece of squid. And you hold the squid in your hand, prep it with your fingers closed, And wherever your hand goes and the squid goes, the rays will follow it. They can smell it. And you can do anything you want with the ray. You can put them on your head, make a stingray sombrero. Kind of cool. But the rays will follow your hand around until you get bored. Give them the squid, they'll eat it, and then go away to the next person. And usually when you get down there, there's probably 10, 15, 20 rays all in one spot. Now what happened is, years ago, the fishing boats would come in, they would clean their fish in one single bay as they went into shore. So the rays figured out if you hang out in this bay, there's a lot of food for you. And then the divers figured out that if you go to this bay, you can have a really good time. Again, here's the ray's mouth on the underside. Normally what these guys do is they cruise along the bottom and they start at the bottom and look for worms and stuff in the sand. But if you're feeding them squid, it's much easier, so they'll take the squid. Alright? Stingray spines have venom on them like we talked about. They have that integument that covers the venom, so if they just touch you with just a tip, you're probably good. But if they get any amount of the point of the spear in you, you're probably going to get envenomated. There's a lot of stuff in there, serotonins, nucleotidases, phosphatases. You know, they're actually a mellow envenomation, but they are much worse trauma than the others. So 30 minutes, usually the venom starts to kick in, and you can get arrhythmias, nausea, vomiting. Again, very hard to find a toilet underwater. Fatigue, swelling, headaches, a lot of like basic symptoms you can get. Here's me trying to put on a stingray sombrero. These guys stab you. Again, cook them up in the hottest water they can tolerate. Make sure you test the water first, but the hot water denatures the proteins. They're probably going to need some pain control. These are pretty nasty stab wounds. Right? If you get stabbed with a knife, you want some medicine too. You want some pain medicine too. And then again, late infections are common because the barb is kind of big and does let a lot of stuff into the hole where it was. I'll talk quickly about electric rays. People have called these numb fish or cramp fish because they'll shock you and everything will cramp up. Everything will get tight. Right? This is the only one that I've ever seen. I've only seen one in my life. And I didn't even know what it was when I first saw it. Actually, my dive guide almost killed me. He was swimming at me, and I wanted to get a picture of him. So I put my fingers in the sand in front of him to stop him to get the picture. And he went around it. So I put my fingers in the sand again, and I kept stopping him wherever he was going. And nothing happened. I was fine. And my dive guide was like banging on his tank, yelling at me underwater. I was like, what? I'm just taking pictures. I got back on the boat. He's like, jackass, that was an electric ray. It could have electrocuted you underwater. He's not that small. I mean, the bigger they are, the more voltage they have. And also, whenever the last time they discharge was, the longer the distance, the more electricity they can build up. So if they go for a long time and they're big rays, they can definitely give you a pretty bad shot. All right? Any place with 8 to 220 volts. They usually will do it in defense to stun you to get away, or for their prey to stun it and kill it so they can eat it. Treat it like any other electrical trauma. Right? If you get electrocuted here in the States, I would put you on a monitor and watch for a little while, see how you did. Same thing for electric rays. Electric eels, very similar. This is also my picture, although I've never been to South America. I took this in an aquarium. That's why it looks so clear and so pretty. But kind of an ugly animal, if you ask me. Sponges, these are porifera. And sponges actually don't have a toxin in them until you mess with them. Until you rip a piece off, bump into them, crush them. Then they start to make toxin. And they actually do it very, very quickly. So this is actually interesting. It's a venomous animal that is not venomous when you first meet them, but turns venomous. Kind of a cool fact. Right? Because they have to produce their symptoms, they often get delayed symptoms. These guys are also made of silicone. Silicone is kind of like asbestos. It's a very irritating, fibrous molecule that if it gets in your skin, it's going to cause a lot of problems. It's going to cause you to form abscesses. It causes a lot of irritation. It's really just a nasty molecule to get under your skin. All right? These guys come in many different shapes and sizes. All right? That was a vase sponge. This is a fire sponge, which is the only really nasty one of the sponges. These live down in Florida and the Caribbean. Some people call them volcano sponges also because they're volcano shaped. But these guys, when you brush up against them, they're so bad that they'll cause a lot of blistering at the spot. Again, big vase sponge, some other tall, skinny ones. The big problem with sponges is they're not all sponge. A lot of them build their sponge on top of coral. Coral is really, really sharp, has a lot of jagged edges. So if you hit a sponge with your arm, you're likely to break the sponge and then get down to the coral underneath it. And then that coral is going to rip through your skin and cause you to have a bigger injury. Again, it's very reactive, like I said before. Wash them off in soap and water, and these guys stab you with those silicone, so hot water deactivates the protein. All right? A couple other shapes and colors. Can be very, very pretty, very interesting. Some vase sponges, some iridescent purple ones are kind of cool looking. Conch, not really dangerous in this form, but I put it in there because it's a cool picture of a conch, and I never knew what they looked like before. I just ate them. This is what they do look like underwater. Of course, deep fried, they can be dangerous. Cone shells, these are the Conidae. They have very similar venom to cobras, to the other elapid snakes. These guys will paralyze you if you get stung by them. Right? Very, very bad envenomations, actually. Luckily, they're very small, slow-moving. Very few people get envenomated by a cone shell. Most of them are beachgoers who pick up the cone shells because they're pretty and don't realize there's an animal inside and get stabbed venom. These guys have a muscular bulb that pumps out the venom, and then they have a proboscis, which is like kind of an arm that sticks out, with a duct in the middle of it. And then they have a radula, which is a tooth that stabs you, and that's how they envenomate you. There are over 200 different conopeptides. Right? There are really only not that many envenomations documented because people just don't touch them, don't get envenomated by them, or they're too slow to envenomate you. I put this up there just so you can see what they do. They do everything. Calcium channels, sodium channels, potassium channels. This one that even has a sleeper peptide, this Conus geographus, that puts you to sleep. You can see if you're a cone shell, it's much easier to catch a sleeping fish than it is to catch a live fish or a wake fish. So it puts you to sleep. Puts you in a deep, deep, deep sleep state. They paralyze you. So you'll have a lot of local pain when you get stabbed. Right? Some nausea, some vomiting, maybe headaches, numbness, maybe some paresthesia at the site. But if it's one of the bad cones, one of the dangerous ones, it can paralyze you. And these guys are located in all the most beautiful areas in the world. In Fiji, in the Indo-Pacific. So if you get envenomated by one of these guys, chances are you're on a liveaboard. You're on a boat that's 3 days from shore. Now you're paralyzed on a boat 3 days from shore. You better hope your friends know, A, CPR, how to give mouth to mouth, and B, that they brush their teeth that day. You don't always do it on a liveaboard. And C, they're willing to do it for you. You better have some good friends. When I travel, I always travel with an LMA because I don't want to have to do my friends mouth to mouth. I know where their mouths are there. I'd rather stick an LMA in and breathe through the tube. But some of them can be nasty. Some of them can cause coma and death. If you don't have anybody that's willing to breathe for you for 2, 3, 4 hours until the venom wears off, 6 hours in a bad case, 12 hours in a bad case, you better be prepared to get mouth to mouth or get to a ventilator pretty quickly. All right? These guys stab you with that quick little tooth, so hottest water possible. Intubation is the cure for paralysis. Right? Intubate and put them on a vent, and you're good. But you've got to be near a hospital to have that happen. Local wound care. All right? There's no anti-venom for cone shells because there's just so few envenomations. It doesn't make any sense. Symptom relief, who knows about antibiotics or tetanus, who knows, but we probably should give them. The blue ring octopus is the first picture that's not mine. These are only found in the Indo-Pacific. They're cute little, like 6-inch octopuses that are adorable and super, super, super venomous. Right? They're pretty, they have these blue colors on them. But if you get bitten by one, you're going to be in a lot of trouble. The good news is that they're very shy, don't mess with humans, go away from you. But the problem is if you corner one, or step on one, or do something bad, you risk getting really, really badly envenomated. Alright? They were first found in 1929, and there are 10 species of them. They're small, they're cute, but there are 26 fatal doses in one little tiny octopus. So that's pretty bad envenomation. They're only found in southern Australia, and their tidal pool's there. So if you don't go there, you're pretty safe. Their venom is the same venom that's found in pufferfish and poison dart frogs. Right? It's a tetrodotoxin. It's lots of sodium channels. It's a neurotoxin. It paralyzes you as well. Right? That's how it kills you by respiratory arrest. You guys have all seen these pretty color frogs that they actually secrete a toxin that goes through their skin. So for them, they're not venomous, they're poisonous. Right? That's the difference. Venom has to go across your skin by a sting, a tooth, something like that. For these guys, if you even pick them up, you can get it when the poison goes across your skin. Treatment, if they get paralyzed, you have to intubate them. You have to breathe for them. There's not much else you can do. And it only lasts for a couple hours if you're lucky, but still, being paralyzed in the middle of the ocean when you're on a boat is kind of a scary concept. So let's review. If they stab you, cook it up in the hottest water you can take. And that's sea urchins, scorpionfish and lionfish, and stingrays. If it stings you, marinate it in vinegar. Jellyfish, Portuguese man-o-war, fire coral. Cone shells and a ballooning octopus will paralyze you to cure this event, and fireworms are the one exception to the rule. They stab you, but put vinegar on it to get rid of it. Let's talk a little bit about poisonous gases really quick. I have a little bit of time left. Most of us breathe air because we're above water, and that is 79% nitrogen, 21% oxygen. When you dive, nitrogen is your enemy. Nitrogen is what causes you to get bent. So I want to have the least amount of nitrogen with me underwater as I can take. So the way I get around that is I take a tank of air and I put more oxygen into it. So now I've gone from 21% oxygen up to 28%, 33% oxygen. Even that little bit of nitrogen you get rid of will allow you to stay underwater longer. So that's your goal, stay down as long as you can. And then you can get really crazy and go to trimix. This adds in helium instead of oxygen to take the place of nitrogen, but it's super expensive. A tank of air costs $2, $4, $6, depending on where you are. A type of trimix can be $50. So if you're going to dive and do the Envenomations, you're not going there for one dive in one day. You're going to do 3 dives a day for 3 days. That's a tremendous amount of nitrogen when you start getting down 200, 250 feet. So it makes sense to go with trimix. So 3 dives a day, 3 days, 2 tanks per dive because you're wearing doubles, $50 a tank. You can see that would really, really build up quickly. So what does nitrogen do? Nitrogen, when it's in air, the partial pressure of nitrogen is 0.8, right? We said it's 79 to 21, or really 80 to 20. That's the proportion. If I compress that air and squish it down underwater, that pressure from the water makes it more concentrated. And if you go down 4 atmospheres, go down 99 feet and 100 feet, now your partial pressure of nitrogen is 3.2. It's way more concentrated. And nitrogen, when it's concentrated, is an anesthetic. So what happens when you get down there? Well, the high pressure makes you feel the nitrogen more. And they call it the rapture of the deep. It gives you a feeling of euphoria or exhilaration. I actually had nitrogen narcosis on this trip. My girlfriend went with me, and she'd never seen her computer in deco before. She'd never been on a deco dive. So I was like, all right, let's push you into deco. Let's go down to 100 feet and stay there until your computer goes into deco. So we got down to 100 feet, and it said 20 minutes no deco time. I wasn't waiting 20 minutes at 100 feet with nothing to do. So I said, let's go deeper. So we got down to 140 feet, and I was like, okay, 1 minute of no deco time. Let's stay here for 1 minute. And then I was like, wow, I feel really drunk. So I definitely had really bad nitrogen narcosis. But it was fun. I stayed there for about 75% of the dive. It was great. It usually starts at about 100 feet, but once you get down to 140 feet, 150 feet, 200 feet, you'll definitely feel it. If you can get down to 8 atmospheres, 200 feet, you're markedly impaired. All right, you're tripping. You can cause unconsciousness, hallucinations. I've seen all these divers down deep giggling to themselves, and I know that they have nitrogen narcosis. Whenever you come across a diver going underwater, you know that they have narcosis. You need to cure them of their narcosis, and the narcosis is just to relieve the partial pressure of nitrogen. Swim up higher and take out the nitrogen that you're using. Let it get uncompressed. All right. We do a lot of deep dives. I dive here in New York, and there's really nothing to see in New York. So what we do is we go wreck diving, and we look for things to take home. And the things you can take home are either pieces of the wreck, like artifacts, or lobsters. So you catch as many lobsters as you can, but if it's a slow day and you can't find any, then you try to find pieces of the wreck to take home. I actually have a bottle from a ship that sank in 1912. That's a full intact bottle, unbroken. It had the cork in when I found it, but the cork dried out and fell out, so it's sitting inside the bottle now. But I have a bottle that's almost 100 years old. Kind of cool. When we go down there, we actually know how deep the wreck is, and we know what the wreck looks like, and we know where we're going to search for stuff. Because you want to find the cool stuff. It's really hard to bring up, a piece of wreck side. But if you can find a porthole, if you can find a cleat, if you can find a bottle, depending on what they're carrying, that's the cool stuff to bring up. All right? You got to be well trained. If you can do your task at 60 feet, and you can do it 10 times a minute, when you get down to 160 feet, you'll be a little bit worse at it, but you'll still be able to do it. And what we do is we train to be confused. We'll go down to 100 feet, and our dive instructor will make us run lines through an old school bus down there. And they'll say, if I show you 1 finger, you show me 2. If I show you 3, you show me 4. Until we get to 5, then show me 0. And while you're running lines, they'll come up to you and start doing this. And it's actually really difficult to do down at 100 feet because the nitrogen definitely messes with your brain. But the more things you can do at once, we call it task loading. The more things you can do at once, the better trained you'll be. The less dangerous your dive will be when you really do it for real on a deep dive. So, again, what happens to you in the water? Loss of judgment, loss of skill, a false sense of well-being. I remember being in the Blue Hole in Belize, which is a super deep dive. I was about 140 feet, and there were a lot of sharks down there with me. And I went to go pet the sharks. I thought it'd be cool. A false sense of well-being, lack of concern for your job or safety. Petting sharks, lack of concern for your safety. Right? Apparent stupidity, petting sharks. Inappropriate laughter. If you ever hear a diver laughing underwater, just swim them up. Do them a favor. Right? Tingling in your lips and gums. Again, the cure is to ascend. Get them less nitrogen in their blood and clear their brain. We have something called the Martini Rule. For every 50 feet of seawater you descend, it's the equivalent of drinking one drink quickly. So I have a pretty good tolerance. I can have a drink, no problem. But give me 2, 3, and 4, I get pretty drunk pretty quick. So if I put you down at 200 feet, it's going to feel like you've had 4 drinks slammed into you. Pretty intense. Fun if you're good at diving, but dangerous if you're not. So let's review. Nitrogen on the surface, very safe, not compressed. Nitrogen has anesthetic effects when it's concentrated, when it's compressed. If affected, ascend to a higher elevation and less concentration. And we get apparent stupidity of loss of dexterity and lack of concern for your well-being. If you don't want to get envenomated by anything, don't put your head with bare skin near anything that can envenomate you. Be careful underwater. Does anybody have any questions?
I actually have a question about one of the fish that we have on the island.
Sure.
When we were kids, everyone said, like, don't touch the spine and sea robins. Do you know if those are actually poisonous?
So they are not poisonous. I've caught thousands of sea robins in my life. I had a boat, and I've gotten stuck many, many times. They hurt, but they're not poisonous. They do have spines.
Okay.
Don't touch them because it hurts.
Yeah.
Right? This is from a dive I did a couple years ago. One of the bigger lobsters that I've caught. This one actually, my partner tried to grab him, and he was too slow, and it caught my partner on the thumb and took off the tip of his thumb, and then I grabbed him from the other side and caught him. So some lobsters can be very dangerous underwater. This one was so big it didn't even fit in my pot. Actually took his claws off and threw him in the pot lid. Good evening. Here's my bibliography. I do want to say quickly, if you guys do vacation, if you do dive, if you do go away, you should be a member of DAN. DAN is Divers Alert Network. They offer dive insurance. They offer trip insurance. If you ever have to be airlifted out of a remote place, it can cost you thousands of dollars. Paying $35 a year for DAN insurance is well worth it if you have any risk at all of having to be airlifted out. It's not only for divers, although it is dive insurance. If you go any place in the world and you're more than, I think, 60 miles away from your home and you have a problem, DAN will help you. If you are in some weird, tropical, no-name place and there's no doctors there, if you call Dan or contact Dan, they will tell you where the closest doctor is, where the closest dive chamber is, and what to do. This is priceless. For $35 a year, it is really worth it. If you travel at all, or if you dive definitely, you should have Dan insurance.
Our patients are pretty good about differentiating between stab and sting.
Are the patients? No,
Yeah.
they don't know. They just say, I got stabbed. You know, it could be a jellyfish and they'll still say they got stabbed. They don't know any difference. That's why I taught you guys what to look for and what to know. If they say what it was. It was this like ball-like thing with a lot of spines sticking out of it. Well, that's a sea urchin, right? Everybody knows what a ray looks like, right? It was a really pretty fish that had all these spines sticking out of it. Well, it's either a scorpion fish or a lionfish or one from that family. You can figure it out. But that's why I want you guys to know it, so you can take care of them when you see them. Anything else? I do want to tell you guys that I appreciate you listening. And the reason I set my phone up this morning is I was sending my lecture out on Periscope. If you guys want, you can look at it for up to 24 hours. But I have a friend in China who runs a residency there, and I sent all my lectures to China so they can view them there. So they don't get enough English lectures in China. So hopefully, all you guys will be on Periscope, and you guys can also.
When in doubt, use hot